STDs, or sexually transmitted diseases, is one of the growing concerns in the Philippines as the number of people infected with STDs continues to rise.
The existing stigma on sexually transmitted diseases prevents people from being informed on what these diseases are, which in turn contributes to the growing epidemic of this disease.
In fact, more than 1 million people worldwide become infected with STDs every day, where in the Philippines, there were 58,181 individuals infected with HIV from January 1984 to August 2018.
The median age of these HIV-positive individuals were 28 years old, while 95% of them were male and 87% of them were asymptomatic.
The most number of HIV cases reported in the Philippines was in the National Capital Region with 404 cases, Region 4A with 155 cases, and Region 3 with 108 cases.
You can get infected with an STD through sexual contact, such as vaginal, anal, or oral sex, and contact with damp or moist objects such as toilet seats, towels, or wet clothing.
People who also have more than one sex partner is also a high risk of being infected with STDs.
Some of the most common STDs in the Philippines are HPV, genital warts, syphilis, HIV and AIDS, gonorrhea, and chlamydia.
It is important for us to be educated on what these STDs are, because every one of us can be infected with these diseases. Being educated denotes responsibility and accountability. An educated individual holds power over the said disease. If we are knowledgeable about STDs, we become more responsible and aware individuals. We uphold our social responsibility of keeping the people we interact with safe from transmissible diseases.
Now, let us be familiar with the sexually transmitted diseases, or STDs, mentioned.
The first STD is the HPV, or the human papillomavirus. This is one of the most common type of STD, wherein 2,053 individuals in the Philippines are infected from 2011 to 2018. Some forms of HPV can also put any woman at risk for cervical cancer, and other forms can cause genital warts.
Genital warts are small, but it can multiply into large clusters. These warts can also develop in the mouth or throat of an individual who had oral sex with a person who has genital warts. The HPV usually has no signs or symptoms, but the genital warts can manifest as small, fresh-colored, or gray swellings in the genital area. Several warts close together, which can look like a cauliflower. Itching or discomfort in the genital area, and bleeding during intercourse.
HPV and genital warts can be diagnosed with physical examination, pelvic exam in women, and the pap smear. Genital warts can go away by itself, but when HPV, it can stick in your skin cells and could cause several outbreaks throughout your life. A regular examination and consultation with your doctor is a must to treat HPV in the right way.
The next STD is syphilis, and about 665 people in the Philippines are infected with this STD from 2011 to 2018. This is a bacterial infection that affects the genital skin and mucous membrane, but can also affect the brain and the heart. At first, individuals with syphilis will have a small, painless sore at the site of infection. But this disease worsens in time, as the individual can experience rashes all over the body, fever, enlarged lymph nodes, fatigue, and soreness.
Without proper treatment, syphilis can cause internal organ damage or even death. Syphilis has also been found to be passed from an infected pregnant woman to her unborn infant. This condition is called as congenital syphilis and can be life-threatening for the baby. Proper treatment and screening to syphilis is a must to treat the disease and prevent its spread. In treating syphilis, it is the best to go to your doctor to get injected with the benzathine penicillin G.
The next STD is the HIV and AIDS, where about 1,098 people were infected with this STD in May 2017. The HIV is the infection of the human immunodeficiency virus, where it affects our body's ability to fight off viruses, bacteria, and fungi that can cause disease. The HIV can lead to AIDS, the acquired immunodeficiency syndrome, which is a chronic life-threatening disease.
A person may appear asymptomatic when first infected with HIV, although after 2 to 6 weeks, flu-like symptoms starts to show. If left untreated, the virus continues to multiply and destroy immune cells, which can cause mild infections and chronic symptoms like swollen lymph nodes, diarrhea, weight loss, fever, and shortness of breath.
The only way to know if you have HIV is to get tested through the rapid HIV test and the ELISA antibody blood test. This is why it is very important to have yourself tested and to know if your partner has been tested for HIV. There is no cure for HIV and AIDS, although people infected with this STD can prevent any further complications by taking medications called ART or the antiretroviral therapy.
The next sexually transmitted disease is the gonorrhea. This is a bacterial infection in the genital tract that can also grow in the mouth, eyes, throat, and anus. First symptoms of this disease can generally appear within 10 days after the exposure, but some people can be infected months before they actually get the signs and symptoms appear.
Symptoms of gonorrhea may include thick, cloudy, or bloody discharge from the penis or the vagina, pain during urination, heavy menstrual bleeding, painful and swollen testicles, painful bowel movements, and anal itching.
Gonorrhea can be detected through physical examination, pelvic exam for women, and laboratory testing of the cervical, vaginal, or penile secretions. Gonorrhea can be cured with antibiotics like ceftriaxone and oral azithromycin. It is best to consult a doctor to know the best treatment for you.
And the last sexually transmitted disease that we will be discussing is the chlamydia. This is a bacterial infection in the genital tract, and mild symptoms usually appear after 3 weeks. Chlamydia can also be passed to one person to another quickly. Here are the symptoms of chlamydia: painful urination, lower abdominal pain, discharge in penis and in vagina, painful intercourse in women, bleeding between periods in women, and testicular pains in men. Chlamydia can be hard to detect or diagnose because the early infections of this disease doesn't present any symptoms. But this disease can also be detected during physical examinations and pelvic exam in women. Laboratory analysis of cervical secretions or urine can also be done to detect the presence of Chlamydia trachomatis.
Contracting these STDs can be stopped through various preventive methods like using condoms during sex. Condoms are not 100% effective in preventing diseases in pregnancy, although they are extremely effective if they are used correctly.
We should also avoid sharing towels and underclothings. Wash ourselves before and after sexual intercourse. Get a vaccination against hepatitis and get tested for HIV.
Having only one sexual partner and engaging in an open and honest conversation with your partner regarding STDs is also a reliable method in preventing STDs. Also, one of the most reliable methods in preventing STDs is to not have sex or by practicing abstinence.
Since some of these STDs are difficult to cure, proper education and safe sex are one of the most important preventive methods.
Removing the existing stigma on STDs is important so we can properly educate ourselves and other people on the spread of this dangerous disease.
We shouldn't be afraid to acknowledge the existence of these preventive methods. We must realize that these things are made to be able to protect ourselves and others from STDs.
Sexually transmitted diseases is a very sensitive topic to talk about. But we need to be enlightened enough by the fact that everyone is prone to these diseases without proper knowledge regarding prevention.
I believe that the factor of our country being dominantly Catholic hinders us from discussing such matters. We should be able to set aside religious beliefs and focus on raising awareness about these preventive methods. After all, our priority is to keep our community safe from such diseases.
So let us be mindful, smart, and well-informed about these certain circumstances. Always remember to protect and take good care of your body because no one else will do it for you. Let us practice safe sex than to say sorry. Remember to practice safe sex and keep your health in check.